Hello and welcome to Legislative Report. I'm State Representative Mark Gillen of the 128th District in Berks and Lancaster counties. When an emergency arises and you pick up the phone to dial 911, you want to know that your call will be answered quickly and that help will arrive in a timely manner. My guest for today's program has served our community by answering those calls of distress. Joining me is Ed Moreland, the Operations Chief for Western Berks Ambulance Association. I'll be asking Ed a little bit about his job and also about how the 911 system works. Ed, thank you for joining me today.
Thank you for having me, Representative Gillen.
This is new for you.
Absolutely.
You said before we came on the air here.
I've been interviewed before, but never in a studio at a sit-down table for 30 minutes straight.
Well, you look very comfortable, and I'm sure you'll do well. A little bit about you, personally. I'm sure some of our viewers would like to know who Ed is.
I am a Washington, D.C. native. I grew up in Washington, D.C. in the suburbs and joined the Marine Corps right after high school, and was stationed at Willow Grove in the very early, actually in 1990, and have stayed. So Pennsylvania has been my home for well over 20 years now.
We won't hold it against you from Washington, D.C., but I like hearing that we're in the Marine Corps. We just honored one of our Iwo Jima veterans on the floor of the House a couple of weeks ago.
Was stationed at Willow Grove for 6 years. Worked in the helicopters that were stationed there, and got to tour the country.
Well, they had their Huey, Chinooks.
We had CH-53 Sea Stallions.
Okay.
And the last Marine Corps A-4 squadron.
Wow. Which
was one of the old light attack aircraft.
And Willow Grove is very much in transition now.
It is. Actually, one of my employees is involved there in her National Guard capacity, and she keeps bringing me back stories of the buildings that I used to work in have been vacant for years, and she says it's kind of eerie to go by there. It's almost like a ghost town. Years
ago, I used to drive to the end the runway there outside the fenced area with friends, and we'd watch the planes coming and going.
Yes, they're right there in Horsham, right at Maple Avenue.
Yeah, I really enjoyed that. In any event, you've got a family, you live in Montgomery County, you're doing a little commute into Berks County.
I live in Pennsburg Borough and commute to my office in West Lawn. Married, wife, 3 children, 14, 11, and 6.
How did you get involved in emergency medical services?
When I was stationed at Willow Grove, I was a single guy and had lots of free time, so I started to volunteer at the local fire department, and then the bug kind of bit me, and then I went to EMT school, and then I decided I wanted to be a paramedic and went to paramedic school, and here we are.
Was there anything seminal in your life as you look back? You said you had some spare time, you said you were a bachelor, but was there a period in your life where you thought you'd be interested in helping in emergency medical services?
My father's a retired police officer.
Okay.
I grew up in public safety. I, as a child, had always known many firemen, volunteer firemen, and career firemen in the area where I grew up in, so it became a natural flow.
I've been an emergency medical technician for 25 plus years, not running with anybody right now.
Would you like an application?
The voters will have to decide that for me if I need an application. But, you know, it's tough work. There's crazy hours involved in this thing. It's stressful. Let's take your managerial position aside. Let's just talk about somebody out in the field. The work is difficult. It's all weather. It's 24/7. It can be hard on a family.
It can be, and it's more of it's a vocation. It to me is truly a calling. These are folks that truly feel that this is where they need to be. This is where they belong. All those things that you talked about as being challenges, many people see as things that they enjoy and like. The difficult environments, the changing schedules, the significant variation. Those things can be pluses to many folks, and our staff and in EMS providers in general, I think that's true.
You've been in this business for a while now.
Yes, sir.
How many years?
25.
Okay. How has it changed?
Much more regulation, much more training requirements. We have to know a lot more about little things. Years ago, we would, when I first started, we were still sending EKG transmissions via radio. We'd plug a radio into the heart monitor and send them off to the hospital so that the doctor could agree with what we're seeing. And we transitioned away from that, and they developed some comfort level with the paramedics and their ability to interpret those. And now we're actually doing it again, because now we're recognizing and identifying heart attacks 20, 30, 40 minutes before the patients get to the hospital. So kind of what's old is new again, but many different changes, technology changes.
Technological changes, cars are safer, highway engineering and so on. We're always going to have accident, we're always going to have disease, we're always going to have heart attacks. But when you look back in that portal of time, is there a sense amongst your staff today, we're really saving lives, making a big difference?
I think there's a couple key areas where we're making big difference. Is heart attack care. Certainly, the ability to recognize those folks having a heart attack and activate the heart attack team at the hospitals before we get to the hospital, well in advance of our arrival, is key. Stroke care is another one where we are doing stroke screenings and can identify strokes as soon as we encounter folks and call the stroke teams at the hospitals. Sepsis, which is something relatively new to EMS, which is severe infection, kills thousands of people every year and is somewhat unrecognized, but we at Western are embarking on a program where we're identifying sepsis patients early. Those are probably the big three in the last 5-10 years.
Where do you see this business 20 years from now? I know it's difficult to pull out a crystal ball or wave a magic wand and say, this is what we'd like if we had the resources. Where do you see the technology going next generation?
A couple different ways. One is there's this debate as to whether EMS is public safety or public health. And I think the answer is yes, we're both.
Okay.
We are public health in the public safety environment, and we're public safety in the public health environment. And rather than pigeonhole us into one particular area, I think we need to remain fluid enough to do both. I can see the community paramedicine, which is still kind of defining itself, where paramedics are going out and doing screenings or follow-ups and trying to work to keep people out of the hospital. I see that as a huge growth area, and in some parts of the country it's working really well, and I think more research needs to be done and to figure out how to reimburse for that. I think the ability to do some video direct to the hospital from the field, and there's some experiments with that, and FaceTime applications help with some of that, but I think that needs to be further defined and a little bit more development for that. And I think the other big challenge for us will be reimbursement streams.
Yeah, and we're going to get to that in just a minute.
Okay.
St. Joe Medical Center, Reading Health System. I esteem them highly. What's your window of looking at those
They're
institutions?
both great facilities.
Okay.
We have excellent relationships with both of them. They have excellent relationships with the EMS community in Berks County and beyond. Both of them have their niche markets, and both serve their patients without question to the highest standards.
This really gets to another strata of questioning, but briefly, St. Joe and its alliance with Penn State and Hershey Medical, the expansion of the Reading Health System into so many different areas, how does that touch your life?
On a day-to-day basis, it really doesn't.
Right, okay. Yeah.
From a management perspective, again, it really doesn't. The faces and the relationships stay the same. We've worked hard to develop relationships with leadership at both facilities and maintain those relationships, because some of their problems are our problems and our problems are their problems. If particular patient population begins to struggle, the sepsis folks, that becomes a problem for everybody. So we kind of all work together to solve the problem.
Let's talk about the funding stream for a minute here. Begin with 911, the system. We've got some legislation we're looking at now.
I've seen the legislation, and I am by no means an expert on 911 system funding streams at all. I know that they get funding. How's that?
Right. Well,
we've now exceeded my expertise on 911 funding systems.
Well, and we won't get deeply into it. We've moved from a landline culture, and there was surcharge to fund the 911 system, and we're moving to new technologies. Certainly, most people are using their cell phones. We have, believe it or not, we have an old rotary phone at our house. Before we moved in, it was left there by the previous owner. It was just plugged in.
And they're great.
And we restored the service, and one of the kids picked up, "Hey, Dad, this phone works." Delink. Well, you know, we're an anomaly. I'm probably going to sell it at an antique store or curios or collectibles. But we're moving away from that to cell phones, and so therefore the legislature is looking at stabilizing the funding stream for the 911 system. When somebody calls 911, let's just take us through the steps of that.
So in Berks County, when somebody calls 911, the phone rings at the 911 center in Bern Township, right across from St. Joe's Hospital by the airport, and it's answered by a call taker who will identify themselves as the 911 center and then ask if there's an emergency. And as they're talking, they're typing simultaneously. As they answer the phone, the information on the caller will populate. So if it's a landline, it goes right back to the landline address and account holder. If it's a cell phone, if it's got GPS-enabled cell phone, it's tracking to their actual geographical location. If it's not GPS-enabled, it's going to the closest tower and identifying where they are to the closest tower. From there, they'll start to determine what kind of needs are occurring. Is it a fire, police, or EMS need, or is it a non-emergency need? And start to type that information. While that's going on, once they've identified what the need is, it goes to the appropriate dispatcher who will either send to the appropriate police department, fire department, or EMS organization.
You're riding in the back of the box, okay, or you're up front headed to the call. Could you take us through a range of calls, the typical, the anomaly, the oh boy, here we go?
There is no typical.
Okay.
That's
what I expected.
If you take the typical off the table,
okay.
You know, there are some that are more routine than others, but nothing is typical. You can always be surprised.
Yeah.
You know, I recall being dispatched to a woman's house, and she was complaining of a toothache, and okay, well, this seems to be kind of interesting, and we start talking to her, and we get a little bit further into it, and we start to take her blood pressure. Blood pressure seems a little high, and we start talking. This woman was having a very large heart attack. She was probably one of the largest heart attacks I've ever seen displayed on a monitor, but her only complaint was tooth pain. So that typical call comes off the table. So we can categorize them into two, maybe three categories. One is the BLS call, which is the basic life support level, and then there's another, the advanced life support, and then a third one, which is kind of, we'll call the high acuity stuff, which is almost always ALS, but gets a little bit more attention just because of what's occurred. So the BLS call would be something that will be cared for by 2 emergency medical technicians who have 200 to 300 hours of training, and they can do splinting, they can give oxygen, they can immobilize folks, they can use an AED, and minimum of two folks on that ambulance. And that would kind of be the person who fell and broke their leg, you know, the kid on the sports field who hurt his shoulder, those kinds of things. Or just the general, I don't really feel all that good, but I can't really pinpoint anything and nothing seems extravagant. The next level would be the advanced life support level, excuse me, and that would be the paramedic level response. And those are folks that can start IVs, they can put cardiac monitors on and evaluate the heart rhythms and analyze the heart rhythms. They can give medications, the much more invasive skill set. And so those would be the folks that are having respiratory distress and chest pain, and they've fallen, you know, the traumatic injuries and things like that. That third kind of subset of calls would be the car accidents where the people are entrapped, and the, you know, the assaults and the shootings and those heavier trauma, and those are going to get a much greater response from not just EMS, but also from police and or fire.
Hold the thought.
Okay.
Right there. Let's take a quick break. Legislative report will return in a moment.
Did you know that Violet Oakley was the first female artist to receive a large commission for artwork done in a United States Capitol building? In 1902, Joseph Houston, designer and architect for the 3rd Harrisburg Capitol building, commissioned Violet Oakley to paint murals for the governor's reception room. He believed that Oakley's contribution would add interest to the building and act as an encouragement of women of the state. Prior to beginning her work for the Capitol, Oakley set out to England to conduct research for her murals. Upon return, she decided to center her artwork on William Penn and the founding of Pennsylvania. Oakley made sure that Penn's ideals of justice and peace could be seen throughout her work. In 1906, she completed 13 murals titled The Founding of the State of Liberty Spiritual and was placed in sequential order around the governor's reception room. These murals were some of the first to be installed in the Capitol. When Edwin Austin Abbey, another artist for the Capitol, died in 1911, Oakley was offered another opportunity to create murals for the unfinished Senate and Supreme Court chambers. Her work on the Senate murals, including International Understanding, was completed by 1919. Oakley then completed the Supreme Court murals, including the Divine Law, by 1927. Oakley is said to be the principal artist for the Capitol with a total of 43 murals on display. She remains one of the greatest muralists in the United States. Now you know.
Did you know that in the corridors in the first floor of the Capitol of Pennsylvania, there are nearly 400 individual mosaics? The idea for creating these intricate tiles was first suggested by Henry C. Mercer in 1902. A year later, he received the commission to prove 16,000 square feet of pavement tiles for the Great Rotunda and corridors of the new State Capitol building in Harrisburg. Mercer set about designing subjects for approximately 400 mosaics. He chose as his general theme the history of Pennsylvania, and he soon realized that his tiles could tell stories. Although the arrangement seems random, the mosaics are very thoughtfully placed in the floor. The tile sequence is roughly chronological, beginning at one end with the scenes depicting the Native Americans. The mosaics progress into the story of European habitation in the New World and encompass the Commonwealth's triumph through process and intervention. Now you know.
Welcome back to the program. Today we're learning more about the operations of our 911 system from Ed Moreland. Ed, let's talk for a moment about major trauma, significant accidents. You have a cooperative relationship with the fire department, and I'm not assuming, I know you're glad to have them on the scene.
Absolutely. They bring for lack of a better word, tools that we just couldn't carry. Their apparatus brings, experience as well as some tools to help us safely get folks out of cars. And other situations as well.
Sure, they've got to crib it, they go to stabilize it. They're making it safe for you as well as the occupant of the vehicle they're trying to extract.
Correct.
Let's say it's 0 degrees outside and we've had some awful weather the last couple winters.
So it's been like today.
How does that change things for you and your staff and trying to work on somebody perhaps who's even entrapped?
Well, I think it does a couple things. One, it makes us be more cognizant of their comfort, the patient's comfort. It requires us to think several steps. Hey, how long is this going to take? What can I do to help with that cold? Do I need more help? Call for that help early so that the help is there when you need it. You're not waiting for that help to come up. We've especially in the last couple of weeks have been encountering lots of icy driveways and sidewalks.
Right.
And an extra set or 5 sets of hands is welcome when trying to navigate a stretcher down an icy driveway or sidewalk.
A word about hypothermia. It's a threat.
Absolutely. And just because you're bundled up doesn't necessarily mean you're not susceptible. Folks that are outside exerting themselves, if they don't take off layers as quickly as they put them on, or are cognizant of taking off layers, and to kind of maintain that temperature balance can certainly get hypothermia just as quick as those that are without coat.
The last couple of years we've had a lot of snow and we've talked about the cold weather. I was talking to one gentleman and said he's glad for the opportunity to get some exercise with the snow. and I cautioned him, this may be stress more than exercise if you're not accustomed to this lifting, shoveling.
Absolutely. I'd like to say that I don't believe we've had any direct significant issues, but that doesn't necessarily mean that they haven't happened or that they couldn't happen. Folks that are hard charging, and especially those that have medical histories that prevent them from exerting themselves in good weather, should probably take heed in foul weather as well. Shoveling snow with a heart condition can be a challenge, and ask for some help. There are numerous organizations, I'm sure, that can provide some assistance.
There was a day in my own family's life where I had to call 911, and I advised the member of my immediate family that I was finding it necessary to do this, and it was like, can't you do something, control this? And I said, no, it's time to bring somebody else in. We ended up with 2 ambulances coming in, advanced life support. Is this particular profession susceptible to hesitating, waiting when it comes to personal attention?
Yes, I've been known to wait till it was almost too late myself. I can remember hurting myself at home and thinking, all right, well, I'll be fine, and kind of waiting it out, and my wife finally going, okay, that's enough is enough. We're taking you to the emergency room. So, kind of like a physician, physician heal thyself, or EMT paramedic take care of yourself. We're certainly we're probably the least likely folks to ask for help, although we give help all the time. And we preach, hey, it's okay, folks will be upset when we come, and I didn't really want all this attention. That's okay, we're here. You're never a bother to us, that's why we're here. We don't think it applies to us.
Well, in line with that, how well do we take care of ourselves personally? There's stress, there's long hours. Look, let's face it, we're not serving health food at these stations.
No, we don't. We try. There's certainly an opportunity for more healthy living. We have again, just like in any workplace or culture, there's subsets of groups. So we have the super healthy folks that take really good care of themselves. The folks are kind of in the middle, and then the folks that don't take care of themselves at all. So trying to maintain that balance is always interesting.
We have full-time professionals in this business, and in many rural areas we have volunteers. In the urban core, we'll have professional fire departments, but most of Pennsylvania is serviced by volunteer fire departments. Could you share a word or two about the volunteer component as well as the professional full-time paid component of EMS?
With the exception of perhaps the city of Philadelphia, I would say that nearly the entire Commonwealth started as a volunteer. EMS in the entire Commonwealth started as a volunteer organization. One of the early paramedic programs in the entire country started in Pittsburgh as volunteers. So we all have some volunteer base. There are, to my knowledge, only 3 volunteer organizations in Berks County, all volunteer. Volunteerism because of some of the response requirements. Not necessarily, I mean, there's still plenty of volunteer EMTs and paramedics. It's not so much the training requirements for the position, it's the overall operational requirements of being able to respond in a timely manner. And frankly, those that call 911 aren't necessarily inquiring as to whether you're a volunteer or not. There's also overwhelmingly across the Commonwealth a decrease in volunteerism in general, not just in emergency services. And as you encounter other volunteer organizations, including the Lions Clubs, the VFWs, et cetera, and you speak with them, they'll tell you that volunteers are becoming very hard to find, and folks are wearing 4 and 5 different positions within an organization just because of the lack of available volunteers.
As we begin to wrap this up, you're running a business, and there's a bottom line.
Yes, sir.
And you have to be solvent in order to continue to provide these services. And we've heard about organizations collapsing under the weight of the financial struggles. What about Western Berks? Where are they on the finances?
I think we're okay. I mean, every organization has challenges. Each organization has to find the balance that's right for them. The Affordable Care Act has certainly put everybody on their heels a little bit. The expansion of Medicaid is going to be huge in the very near future. Medicaid and Medicare funding for EMS is considered transportation. We don't necessarily get paid for care, we get paid for transportation. So if we encounter a Medicaid or Medicare beneficiary and provide care but don't take them to the hospital, we don't get reimbursed. So that, I think, is a huge thing that needs to change. Medicaid reimbursement is woefully underfunded for EMS. It pays, every time we encounter a Medicaid patient, we are losing money. Every time we touch them, it costs us money because we're not even paid for the level of care that we give. So finding a way to mitigate some of those challenges is going to be something for us, all of EMS, to look to in the future.
So if the reimbursement environment were to change even more negatively, perhaps that would affect your bottom line in a cataclysmic way?
It could, absolutely. I think the other is direct pay, and many folks that have commercial insurance, when they are transported to the hospital by ambulance, the payment for that transport or for that ambulance ride is mailed to them in the form of a check by their insurance company to the patient. So then the EMS organization has to go recontact the patient to get that payment.
Are you equipped to gather those funds?
We're equipped. I mean, we do it. We've been doing that for years. But that's a constant challenge.
It costs to chase the money down.
Absolutely. It's kind of an unusual industry where I can't select my clientele, and the money, the payment for my services goes somewhere else other than your pocket or back into your coffers directly.
Let's take a look at Berks County relative to other counties. I enjoy the quality of life in Berks County. When I think of the ambulance and fire and municipal services and police, I think outstanding in Berks County. You've had windows of opportunity to look at other places. How do you compare Berks to the rest of the EMS world?
I think your assessment's on point. I think each organization has its own anchor within its community, and that is a strength that you don't necessarily find elsewhere across the Commonwealth. I think that the relationship that the EMS organizations have with each other and in Berks County is also a strength. You know, we meet on a monthly basis, we discuss EMS issues, we meet with the Department of Emergency Services. So those are all strengths that I think don't necessarily occur in every county and every community in the Commonwealth.
When I encounter your staff, and some of them have been there a while, I get the sense that there's some continuity in this organization and people stay around a while.
We have a very good retention rate. We have some 25-year plus employees. So in the EMS community, that's almost unheard of. I mean, that's many organizations have one or two. We have more than two, that's for sure.
And that's due to likable leadership?
I would like to think so. I've not been there that long, but I'd like to think that the last couple of years they stood by, yeah.
I thoroughly enjoyed this discussion.
Thank you very much.
Thank you very much, my friend.
Thanks for having me.
That's all the time we have for today's program. I'm State Representative Mark Gillen. If you need assistance with any state matter, please feel free to contact me at my local office or through my website. The address and number will be shown in a moment. Thanks for watching, and please join me next time for Legislative Report.